My name is Mark McIntee. I'm a physician assistant here at Michigan Neurology Associates, and I'm going to be discussing interventional pain procedures that we do here at Michigan Neurology Associates. Back pain is something almost all of us will have to deal with at some point in our lives. Fortunately, most of us will have temporary symptoms that resolve with rest, over-the-counter medications, physical therapy, and time. When your back pain has persisted more than 6 months and has not responded to conservative management, you may meet the definition of chronic pain syndrome. Minimally invasive interventional pain procedures may be a good option to help with your pain symptoms before considering open surgery. So what is an interventional pain procedure? Interventional pain procedures are minimally invasive procedures that specifically go after pain-producing targets in the bodies. These procedures can address pain generators in the neck, low back, hips, knees, shoulders, and many more areas. When we review an MRI, we frequently find multiple degenerative abnormalities. Just because something appears abnormal on imaging does not necessarily mean that it's the cause of your pain. Minimally invasive interventions can help us both diagnose and treat the source of your pain. I'd like to talk about a few of the interventions we do here in our surgery center and the types of problems they can address. One of the most common procedures we do here are epidural injections. An epidural delivers a local short-acting anesthetic and a potent anti-inflammatory steroid medication just above where the spinal nerve roots of your back are located. This procedure typically only takes a couple of minutes. It will frequently help pain felt in the neck, radiating to the arms, or the lower back, radiating to the legs. These conditions can be caused by herniated discs or other degenerative changes in the spine. There are a wide variety of approaches that can be taken depending on a patient's specific situation. Medium branch blocks can be a useful tool to treat and diagnose pain in the low back and neck. This procedure blocks the nerve that is responsible for pain perception from the facet joints. The facet joints are the joints between the bones of the back that allow our spines to move. They are frequently responsible for axial pain, pain that stays in the back or neck and does not travel into the arms or legs. During this procedure, we put a small amount of anesthetic next to the nerves that goes into the facet joints. If it's the correct target, we expect that you will be able to move and function more normally with less pain. If it helps but doesn't last long enough, you may be a good candidate for a procedure called an RFA or radiofrequency ablation. The RFA procedure is very similar to the nerve block. Instead of simply using anesthetic to numb the nerve, we use targeted radiofrequency heat to burn or lyse the nerve. This will give you the same pain relief as the nerve block, but can last 6 to 12 months. The nerve we ablate does eventually grow back. When it does, we can repeat the procedure. It takes about 15 to 20 minutes and can provide long-lasting pain relief without pain medication. It can help with improved function and quality of life. There are many patients we care for here who have had spine surgery that unfortunately did not fix their chronic daily pain. These patients do not have another good surgical option, or they have severe nerve pain that hasn't responded to pain medications. For these patients, spinal cord stimulation can be a life-changing option. All of the pain you feel travels from the peripheral nerve roots into the spinal cord, then up to your brain. And when that signal reaches your brain is when you feel the sensation of pain. During a spinal cord stimulation trial, we insert a thin, flexible wire or lead through an epidural needle. The goal is to electrically disrupt some of those pain signals from reaching your brain. The result is you feel less of your chronic daily pain, and you can focus on enjoying life and the people around you rather than focusing on your pain. If a trial is successful, a permanent device can be implanted. There is no single procedure that works for everyone. A lot of the time, it's a systematic combination of procedures, medication, and therapy that will give you your best pain relief and overall improvement in daily function. At Michigan Neurology Associates, you have the benefit of having all these related professionals and treatments under one roof to maximize your individual treatment options.